Sudden onset of severe pain in a patient with multiple myeloma is a critical symptom that warrants immediate evaluation. It can indicate several potential complications related to the disease. Pathologic fracture caused by weakening of bones due to osteolytic lesions from Symptoms are acute, severe, localized pain, often in the spine, ribs, or long bones. It requires urgent imaging, e.g., X-ray, CT, or MRI, to confirm the fracture and guide treatment. Spine fractures can lead to spinal instability or compression of nearby structures. Spinal cord compression caused by vertebral fractures or plasmacytomas compressing the spinal cord. Symptoms: intense back pain, often radiating. Neurological symptoms: weakness, numbness, or tingling in the legs. Loss of bowel or bladder control in severe cases. A medical emergency requiring immediate imaging, MRI preferred, and interventions like corticosteroids, radiation, or surgery. Bone crisis caused by progression of osteolytic lesions or bone metastases. Symptoms are sudden pain in affected bones, potentially aggravated by movement. Indicates active disease progression and the need for treatment adjustments, such as bisphosphonates or other myeloma therapies. Acute renal failure rarely presents as pain, caused by hypercalcemia or light chain deposition affecting the kidneys. Symptoms are diffuse or flank pain if renal capsule stretches, nausea, vomiting, or altered mental status due to hypercalcemia. Requires immediate evaluation of kidney function and calcium levels. Plasmacytoma progression caused by growth of plasmacytomas, tumors made of myeloma cells, compressing surrounding tissues. Symptoms are pain localized to the area of tumor growth. Suggests disease progression and the need for imaging and possibly radiation therapy. Infections, osteomyelitis or soft tissue, caused by myeloma-related immunosuppression and bone damage predisposed to infections. Symptoms are severe localized pain with fever, swelling, or redness. Requires antibiotics and imaging to rule out abscess or osteomyelitis. Nursing consideration for severe pain in multiple myeloma. Assess the patient. Pain assessment. Use a pain scale, 0 to 10, to quantify severity. Determine location, radiation, quality, sharp, dull, etc., and aggravating/relieving factors. Pain is manageable with the right interventions. Identify red flags. Neurological symptoms: weakness, numbness, loss of bowel/bladder control. Fever or signs of infection. Severe localized pain in bones or back. Early treatment of complications prevents severe outcomes. Initiate diagnostic workup. Laboratory tests: serum calcium, hypercalcemia. Kidney function tests, creatinine, BUN. Complete blood count, rule out infection or anemia. C-reactive protein, CRP, or ESR, for inflammation or infection. Imaging: X-ray, to evaluate bone fractures or lesions. MRI, preferred for spinal cord compression or soft tissue involvement. CT scan, useful for bone integrity and detecting lytic lesions. Bone scan or PET-CT, for widespread bone involvement. Symptom management. Pain control. Mild pain, acetaminophen or NSAIDs, if renal function allows. Moderate to severe pain, opioids, e.g. morphine, hydromorphone, with adjuvants like gabapentin or pregabalin for neuropathic pain. Bone pain, consider bisphosphonates, e.g. zoledronic acid, or denosumab. Hypercalcemia management, if present. Aggressive for hydration. Loop diuretics, e.g. furosemide, to promote calcium excretion. For bisphosphonates, e.g. pamidronate or zoledronic acid, or calcitonin for rapid calcium lowering. Neurological symptoms, e.g. spinal cord compression. Administer high-dose corticosteroids, e.g. dexamethasone 16 to 24 mg/day. Immediate referral for surgical decompression or radiation therapy. Infection management. Broad-spectrum antibiotics if fever or sepsis is suspected. Treat the underlying cause. Pathologic fractures. Orthopedic consultation for surgical fixation if needed. External bracing for spine fractures. Spinal cord compression. Radiation therapy or surgical decompression. Active myeloma disease. Review and adjust systemic therapy, e.g., bortezomib, lenalidomide, or chemotherapy. Consider plasmapheresis if hyperviscosity is suspected. Monitor and follow up. Pain relief evaluation within 24 to 48 hours. Monitor for adverse effects of opioids or steroids. Repeat imaging is needed to track treatment response. Patient education for managing pain in multiple myeloma. Understanding the pain. Pain can result from bone damage, fractures, or tumor growth. Prompt reporting of new or worsening pain is crucial. When to seek immediate help. Severe, sudden pain that disrupts daily activities. Pain associated with numbness, weakness, or difficulty walking. Fever or chills with localized pain may indicate infection. Pain management at home. Take prescribed medications exactly as directed. Use heat or cold packs for temporary relief, as advised. Avoid activities that may strain or injure the bones, e.g., heavy lifting. Preventing complications. Stay hydrated to prevent kidney damage. Maintain mobility within safe limits to avoid deconditioning. Follow up regularly for bone strengthening treatments, e.g., bisphosphonates. Lifestyle tips. Maintain a balanced diet rich in calcium and vitamin D. Avoid smoking and excessive alcohol intake, as these can weaken bones. Report any changes in symptoms during treatment.